When untreated, polycystic ovaries can result in serious complications. It's important to understand that polycystic ovaries does cause infertility, but at the same time, we also have to understand, in spite of irregularity of menses, there's a certain percentage of women who tend to conceive naturally, even with the random ovulation that can happen once in a while. However, in the event that a lady doesn't conceive, say within 6 months or so, and if the cycles are irregular, meet a healthcare provider and take some ovulation induction medications that will help in correcting the ovulation and gives her a good chance of conception. If the ovaries are not responding to lifestyle changes, ovulation induction medications, or if the lady is injection dependent to form an egg. In such situation, women may have to consider treatments like IUI, that is intrauterine insemination, or an IVF, which is called as in vitro fertilization, especially because when women need injections to form eggs, there's a condition called as ovarian hyperstimulation, which tends to happen if they get pregnant. So ovaries that are already stimulated and big enough eventually can balloon further once they get pregnant, increase in size further, leading to accumulation of water in the abdomen, around the lungs, leading to a condition called as ovarian hyperstimulation syndrome. It's important that when women are seeking out fertility treatment, that this condition needs to be avoided, and the only way of avoiding it would be either considering very low dose of stimulation if they are injection dependent, and if in case doctor is not able to get 1 or 2 eggs to develop with injections, then consider an IVF, wherein you have a good control and you can easily avoid ovarian hyperstimulation syndrome. The other risk factors of polycystic ovaries is diabetes. Now, inherently polycystic ovaries tends to cause hyperinsulinemia, which in turn leads to hyperglycemia, that is enhanced glucose levels in the body, which makes the lady more at risk of developing gestational diabetes and also type 2 diabetes. The only way of treating it or reducing or mitigating this risk is by making sure that the lady is at the lower end of the BMI, exercising regularly, having a good lifestyle. Plant-based diet is known to be helpful with polycystic ovaries. That is also something that women should consider. Third and the most critical or dangerous complication that can happen is endometrial cancer. Now, I do understand that cancer tends to alarm a person, but I must say this happens only when the condition is neglected over prolonged periods of time. If a lady has prolonged periods of irregularity of cycle, say over years, the lining of the uterus can grow uninhibited, and this in turn can lead to a condition called as endometrial hyperplasia, which is considered as a pre-malignant or precancerous condition, and if still left untreated can convert into a cancer. So it's important that women who have irregularity of menses seek out help from their healthcare providers to make sure that they have regular menses and shed their endometrium at least once in 2 months, if not earlier. The other risk factors of polycystic ovarian syndrome include depression and mood disorders, anxiety, etc. Now, these are common manifestations in women with polycystic ovaries, and this is because of the hormone imbalance they have. And this can be confounded by matters of obesity, because weight gain is also an issue in such situation, with hyperandrogenemia, because hirsutism and excess hair growth on the face can reduce the confidence in the person, and all these things can add to manifestation of depression. So it's important that while doctor is treating the physical manifestation, the emotional quotient is also taken into consideration during the management. Metabolic manifestation of polycystic ovaries is also one of the serious complications of polycystic ovaries, and these things happen due to hyperandrogenemia. So having high male hormones tends to put the lady at risk of metabolic disorders, especially affecting the heart health and hypertension. So as the person is afflicted with polycystic ovaries, it's important that the lady has an eye on her blood pressure, on her sugars, and also cardiovascular health. It's important to have regular checkups in these areas to make sure she maintains her good health. The tests that would be needed for a diagnosis and management of polycystic ovaries, and the most important one would be an ultrasound, a pelvic ultrasound, to identify that there are polycystic ovarian morphology seen on the ovaries. The other test would be some blood tests, because hypothyroidism, hyperthyroidism seems to be more common in polycystic ovaries. It's important to check the thyroid status. There's a hormone called as prolactin that also tends to be higher in women with polycystic ovaries, so checking serum prolactin levels would be important. The secondary hormones, that is the ovarian hormones, FSH, LH, estradiol hormone, helps in assessing if there is increase in LH. PCO women tend to have a high basal LH. This helps in managing the problem, so it's important to check these hormones. Last but not the least is serum androgen levels, that is testing the male hormone in the lady. This helps in managing the problem that the lady may have due to polycystic ovaries. The other very important test is a sugar test along with serum insulin levels. Serum insulin levels may or may not be needed, but however, sugars need to be checked, basically because if sugars are high, managing the diabetes or borderline high sugar is extremely important. Management of polycystic ovaries would depend on what the symptom is. If it's irregularity of cycles, then we need to go that path. If it is infertility that is affecting, then treatment would be different. If it is hirsutism, that is excess male hormones leading to cosmetic issues, then the treatment would be different. While doing all this, it's very important that the advice about lifestyle and to check whether the emotional well-being is fine is extremely important. In the management of polycystic ovaries, it's very, very critical that the patient participates in the management. It's very important that the lady has a good diet plan which she follows diligently, that she has a good exercise plan, and also has a aim for weight loss if in case she is on the overweight or the obese range, because weight has paramount role to play in the pathology of polycystic ovaries, and weight loss itself can actually correct the problem. At the same time, if there are signs of anxiety, depression or mood disorders, it's important to seek out therapy and counseling. Now coming to individual manifestations. So if it's abnormal uterine bleeding, usually irregularity of 30 plus or minus 5 days, there need not be any treatment, only lifestyle modification should be more than enough. But however, if the cycles are going beyond 2 months, 3 months, it's very important to seek out medications. There are medications that will help in correcting this problem. It could be in the form of the contraceptive pills which help in regularizing the cycle, or it could be in the form of a cyclical progesterone which the healthcare provider might give you, which helps in inducing your cycle. So once this abnormal rhythm of the cycle is corrected, abnormal bleeding also comes into control. It's important to understand that when a lady has prolonged absence of menses is when she'll land up with heavy and prolonged bleeding. So correcting the duration will automatically correct the amount and duration of bleeding. The second important problem, which is infertility, how do we manage it? Now, when the person is young, we could always take time for making changes in the lifestyle, get on to a good weight loss plan, and weight loss so many times corrects the ovulation and your fertility also will return back to normal. But however, in spite of being in the lower BMI range or in the normal range, if the lady has polycystic ovarian syndrome, which we sometimes refer to as lean PCO, in such situation, we may have to consider medications to correct the ovulation straight away. These medications are called as oral ovulogents. They are medications that will help in correcting the egg development. The common forms that are used is clomiphene citrate and letrozole. Both of them have their own mechanism of actions and they tend to correct ovulation in majority of women. So taking these medications to correct the ovulation also will help in overcoming the fertility issue. The other manifestation of polycystic ovaries, which is hyperinsulinemia and gestational diabetes, predominantly is on lifestyle management. That is a good diet, a good exercise plan. If in case the person is not able to manage it themselves, then to seek out help in the form of, there are several apps now available to download something, get onto some platform of weight loss and be on a healthy plant-based diet. These things are known to help women for weight loss and also reversing polycystic ovaries. At the end of it, I would also like to say that polycystic ovarian syndrome itself has its peaks and troughs. There are times when it manifests in a major way and there are times when cycles are just regular without reason, right? So treatment should be sought, especially when menses is irregular and the symptoms are manifesting. It's important to be aware if one has that condition to have regular health checks at least once in a year to see how the ovaries are performing, to have a review of all the symptoms and then take care of their health.